Hi, this is Dr. Sai Ravi Shanker. I am the head of the Department Cardiology, Aster Prime Hospital. So, though so much of confusion, chest pain is a very important clinical sign. So, chest pain, heart pain, or chest pain, gastric pain. Today we will discuss about the chest pain. It's a heart related or gastric related. Any patient is having a comorbidity like by diabetes, hypertension, cholesterol high, smoker, family history, or a sedentary lifestyle, obesity. These are the high risk patients. For this type of patient, chest pain is very important for that. So, chest pain in heart patients, chest pain usually start with a retrosternal chest pain, means in the center of this chest or the left side, usually radiate to the left hand, may or may not be. The chest pain may be not only here, it may be in the angle of mandible or in the jaw or in the back side. It may be atypical chest pain also, atypical presentation also. Usually it is associated with profuse sweating and breathlessness. If the patient is having profuse sweating, breathlessness, chest pain and fatigability, very weak, you cannot do anything, and the chest pain will aggravate if the patient slowly walks or do some activity. This is a typical heart pain. Any chest pain aggravates by walking or any exercise or some sort of movement any exercise. So pain is anginal pain. Coming to the gastric pain, usually specifically it's in the empty stomach or after food. Usually in a specific time only. It must be there for last 2-3 years, or this is gastric related. Once you take food, pain will relieve. It is unrelated to your activities and exercise. If you walk also, the chest pain will be there. If you stop also, pain will be there. But heart pain, usually if you walk, pain will increase. If you take rest, pain will decrease. That is the most important differentiating feature this gastric pain. And usually gastric pain is below umbilical, usually in the stomach, but chest pain is here in the retrosternal. So this is the basic, but I request if somebody is having any risk factor. So what are the risk factors? Which I have told: hypertension, diabetes, cholesterol, family history, smoking, and a sedentary lifestyle, no exercise, obesity, and a strong family history. These are the main risk factors. Other than this risk factor, now there are so many emerging risk factors, which is a very important for young heart attack, is the mental stress. Mental stress is one of the important emerging risk factor. And second is the diet. Junk food, fast foods, these are the unhealthy foods which they are taking mostly by the Swiggy and Zomato, which is a 10 minutes cooked food. That is a very dangerous to the heart. Third is a lack of exercise, and fourth is a deprived of sleep. So a person requires at least 8 to 9 hours, 7 to 8 hours of the sound sleep, uninterrupted sleep. That is a very important for the cardiac problem. So if these patients are having any chest pain, there you should immediately consult a cardiologist or a doctor, take a ECG. If it is possible, small blood test, troponin test. By that, any doctor will conclude that you are having a heart attack or not. If it is a heart attack, a golden hour is there. It is a 3-hour golden hour is there. You please treat. If the patient is treated within the golden hour, that is 1 to 3 hours, we can save the patient happily, and we can save the heart muscle. Every minute is a dangerous to the heart muscle. Time is a muscle. So if you are treated within the golden hour, like 1 to 3 hours, the future complications are very less. Thank you.